name's Glenda Fincher, and I'd like to thank the high school nurse of Lorena, Texas for inviting me to educate high school students on asthma and asthma health care, how it can affect the community, and how we can improve overall health care for students with asthma.
Recording? No.
The definition of asthma. Asthma is a chronic inflammatory disorder of the airways involving bronchial hyperresponsiveness and airway obstruction. Asthma has marked periodic attacks of wheezing, shortness of breath, tightness of the chest with a cough that produces mucus due to an allergic reaction. Asthma does have familiar tendencies, therefore increasing your odds of acquiring the disease or being born with it. The pathophysiology of asthma. Now let's look at the diagram, and we can look at the man's lungs where they're actually showing a bronchial tube that's during an asthma attack. The major pathological feature of asthma is inflammation. Inflammation resulting in hyperresponsiveness of the airways. The NKT cells release cytokines in response to the allergen triggers, creating inflammation. This causes muscle spasms of the bronchial tubes and constriction of these airway passages. The passages become inflamed and mucus-filled, limiting the intake of air. Triggers. When we talk about triggers, it's real important that you learn what triggers your asthma attacks. What you need to do is keep a daily diary and know what those triggers are. According to Asthma Facts, we don't know for sure what causes asthma, but we do know that attacks are sometimes triggered by allergens like pollen, mold, animal dander, dust mites, sometimes even exercise, occupational hazards. On the diagram, you see a gentleman who is using a paint gun to paint a car. They say that even tobacco or smoking, air pollution, respiratory infections can cause airway problems also. Symptoms of an asthma attack. Coughing, hacking, shortness of breath or trouble breathing, wheezing, tightness or pain in your chest, the use of your accessory muscles to breathe. Have you ever seen someone trying to breathe and struggling, and they'll actually use their shoulders to help them breathe? Adults are less prone to have asthma than children. So when we look at the impact on the population and the community, we look at a resource or a graph from the National Health Interview Survey and the National Center for Health Statistics and the CDC. This graph has current asthma prevalences and percentages by age, sex, race, ethnicity, and the United States in 2012. In children, boys are more likely to have asthma than girls. More females are prone than the males. If you look at the graph, you see the numbers, and it shows you that the males are 7%, where the females are 9.5%. Related to race and ethnicity, multi-race and black adults are more likely to have asthma than white adults. And the least likely is your Hispanic race. Black children are 2 times more likely to have asthma than white children. According to the CDC, in the last decade, the asthmatic population in the community has grown by 15%. I find that a remarkable number in an age where we have done so much with medicine that asthma is growing and not decreasing in our population. So what can we do to stop this deadly growth in our communities? Educate. As nurses and doctors, we need to educate on good prevention and healthcare practices to reduce the number of deaths, hospitalizations, visits to the emergency room, and decrease the number of missed work days and school days in our community. The most common asthma medications. The inhaled corticosteroids, or the ICS. They are the most effective anti-inflammatory medications for the treatment of asthma. You have your beclomethasone, your busonoside, your cyclosonoside, your fluocinolone, and there are a few examples of the inhaled corticosteroids, and there's many others. The side effects of these inhaled corticosteroids include oral candidiasis, or a yeast-type rash in your mouth, dysphonia, reflex cough, and bronchospasms. Rinsing your mouth after inhalation reduces oral candidiasis or yeast. Smoking decreases the effectiveness of the ICS. Patients with asthma should stop smoking. Corticosteroids are used for long-term control of persistent asthma across all age groups and in all the therapy care steps. Dosing is based on the severity of the attack. The beta agonist treatment, when used on diabetics, we need to be aware that it can affect your blood glucose levels, and you need to check your blood sugars daily. Important education. If you have no relief from your rescue inhaler after 3 doses of SABAs, your short-term bronchodilator treatments in 1 hour, or needing a dose more frequently than every 4 hours, it's time to seek medical care. So keep that in mind. Medications commonly used in asthma. Your short-term beta agonists. They're used for quick relief of bronchospasms, prevention of exercise-induced asthma. The examples that I'm giving you, there's more than this, but the albuterol and the levobutrol are probably the most common used. Then you have the aminophylline and the theophylline, epinephrine. These drugs are used for emergent control when indicated. You've got your long-term care beta agonists. They are not used for acute treatment. They are frequently used as preferred add-on to your corticosteroids. An example of these would be formoterol and salmeterol. Side effects of your beta agonists are heart palpitations, chest pain, rapid heart rate, increased blood pressure, tremors, or nervousness. So you need to monitor labs, including your theophylline levels for toxicity, and this may decrease those potassium levels or even give you episodes of hyperglycemia. So again, if you are diabetic, you need to check those blood sugars.